I think there's been three main themes that have come through for me. We've been working really hard over the last few years as an organisation to try and build our allied health base. And this year we've really seen a really big growth in our attendees from allied health professionals. So that for me has been extremely exciting. One of the real highlights for me was this morning's Meet the Expert session, where we had a combination with a very experienced oncology occupational therapist alongside one of the editors of JTO, and they talked about how we can do a lot more evidence-based research and then how you can go on and get that published. And for me, I think that's something we need to really drive home over the next few years, is how we can raise the calibre of the science in the nursing and allied health track. So I think that leads to the second theme for me, which was around global collaboration. You see people developing friendships and relationships while they're at the conference, not just with the nursing and allied health, but also across with their radiation oncology colleagues, with the surgical teams, with the medical oncologists, and it's just really lovely to see the collaboration and ideas coming together. And then I guess the third thing that's really stood out for me this conference was one of my colleagues shared something this morning, which I'm not going to quite remember, so I've got it written down. She said we need to do as much as we can, as well as we can, for as long as we can, and for as many as we can. And for me, I think that really underpins the ethos of the multidisciplinary approach for treating people with thoracic malignancies. And just that if we can maximise people's quality of life during these years of survival, we need to do that by utilising the MDT, the multidisciplinary team, and our nursing and allied health colleagues. So for me, I feel like that's just a really strong theme coming through in the conference this year.